You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today joins me from Sydney in Australia. Anthony Flynn is the General Manager, Programs and Information Services of Asthma Foundation, Queensland and New South Wales. Anthony, welcome to Health Professional Radio.
Thanks, Wayne. Thanks for having me.
Now, Anthony, I guess many people have some view about what the Asthma Foundation does, but fill us in. What is it that you really do, and what geographic area do you service?
The Asthma Foundation of Queensland and New South Wales now, which is the product of the recent merger of the two states' foundations, basically sees itself as the voice for consumers, for people, regular people in the community with asthma who are facing the challenges around how they best self-manage and how they look after each other around asthma. So what that means, what that boils down to for us is we do three things. We essentially deliver education and training programs to people who are directly involved in looking after other people with asthma. We provide a telephone-based information, education and support service via what we call the 1-800 Helpline, and that is a group of asthma educators who take calls from anybody who has an asthma-related question and helps them through what might be a self-management question, how to use their device or how to understand the medication or their treatment better, to anyone from the health professional community who might have a question around how to best construct an asthma action plan. And then thirdly, we consider, as I said earlier, ourselves the voice for people with asthma. So we engage in advocacy campaigns on behalf of people with asthma to hopefully improve the environment for people with asthma in the community, as well as investing a lot of time and some finance in research for looking at everything from the biological bases of asthma and trying to find some inroads towards curing the disease or finding some more definitive treatments, all the way to researching the challenges that people face in respect to accessing asthma medications and balancing those challenges with the other challenges in their households to be sure that they have the best access to medications when they need it for their asthma management. So that basically sums up the three areas that we prioritise and the way we consider our role to look for the community of people with asthma. We work in, our jurisdiction is New South Wales and Queensland. So we do have interactions with people from around the world who tap into our website and look at the resources and upload some of the resources we have available to help them in their respective communities looking after the people with asthma.
Anthony, thank you for that. I notice on your website you've got some facts about asthma, and many of our listeners are clinicians of one kind or another, and you kind of assume that they would be aware of the extent of this. But just for those people who are not clinicians or for whom the figures have faded away, can you fill us in a little bit about the scope and size of the asthma problem in Australia?
Yeah, I'd be happy to. Thanks, Wayne. So, well, the first figure that's important to acknowledge is that asthma affects 10% of Australians, and that figure puts us as the highest or one of the two highest prevalence countries in the developed world, and that's I think telling in itself as to the extent of the challenge that we're facing and the reason the Asthma Foundation has a role to play. Third, it affects Indigenous Australians, Aboriginal and Torres Strait Islander people, 3.8 or almost 4 times more than it does non-Indigenous Australians, and they have 2.5 times worse outcomes as a result of asthma than non-Indigenous Australians as well. So that's something that we'd really like to have an impact on as well, and quite obviously. Asthma is the leading cause of hospitalisations for children especially aged between 5 and 14 years, and it's the leading cause of burden of disease for children in that age group as well. It's the 4th leading cause amongst all chronic illnesses of quality of life disruptions in Australia. So people who experience asthma symptoms and asthma complications need to stay at home from work, need to stay home from school, need to stay at home to look after their loved ones, and it has an obvious impact on their quality of life and other things like earning capacities and so on. It's a disease or an illness that affects lower socioeconomic groups worse than others as well. And the most recent economic report that was commissioned by the Asthma Foundation, the Asthma Australia, and the National Asthma Council through Deloitte Economics revealed or estimated that the burden of disease as a result of asthma is $24 billion per year to the Australian economy. And that means that the years of life lost due to asthma, as well as the years of life affected by the disabilities and the complications of asthma, equate to that astounding figure for the community of Australia. So there are some big figure, high-level statistics for us to appreciate.
Yeah, I guess it's easy from a person sitting on the outside who's not affected by asthma and doesn't have asthma in the family at all to go, well, it's a simple thing. You take a puffer and you get on with your life. But I notice here in your statistics, approximately 400 Australians die from asthma. That's a much higher figure than I would have thought.
Yeah, that's great, and it's great that you acknowledge that, Wayne, and we agree that it's a higher figure than what we think is necessary to die from asthma. Yeah, it is. That's a misconception that, if I have asthma and I take my puffer and it relieves the symptoms. Actually, probably the single biggest challenge we face at the moment in asthma management is to get people to understand the importance of using their preventer medication. So this is different to their puffer, as you would call it, the blue puffer that we have always known and felt to be synonymous with asthma control. The preventer medication comes in a variety of colours, so we won't refer to the colour, but it's an inhaled corticosteroid typically, and it's the medication that keeps the symptoms at bay. It reduces all of the inflammation, the swelling, the mucus production that leads to the symptoms of asthma, that enables people to as I said, to not experience the symptoms and maintain good control of their asthma. And recent statistics produced and research produced by friends at the Woolcock Institute and the University of Sydney revealed that of all of the people that should be taking their preventer medication as indicated by their clinical condition and according to the treatment guidelines, up to 90% are not taking it or are taking it 50% or less of the time. So we've got a real challenge here, and another huge role for the Asthma Foundation to start to engage with people and understand the challenges that they face with taking their preventer medication and work on strategies with them to improve that preventer medication adherence. And I guess if we flip that statistic around so it's 10% rather than 90% or even halve it, then I'm sure we're going to see a substantial improvement in the mortality as a result of asthma and all of those other quite self-evident statistics that I referred to as well.
You're listening to Health Professional Radio. My name is Wayne Bucklar, and I'm in conversation with Anthony Flynn, the General Manager Programs and Information Services of Asthma Foundation, Queensland and New South Wales. Anthony, as you probably know, most of our listeners, we think about 95% of them, are clinicians of one kind or another. We get a lot of people in both in hospitals and in aged care listening to the program because we're such a fine and splendid source of clinical information and because we don't play any rap music. But anyway, enough of that. For those clinicians listening, Anthony, is there a takeaway message for them today as a result of having heard you on Health Professional Radio?
Yeah, I think there are a couple of take-home messages. One is that the challenge of asthma is by no means being solved in Australia, and we need to continue to look deep into what we are doing at a local level, on an individual level, in respect to empowering our patients to better look after their asthma so that they suffer less complications and at less risk of bad outcomes. And doing that, and they can do that by using the Australian Asthma Handbook developed by the National Asthma Council, also colleagues of ours in the industry, which is really the world's leading reference document that explains and really sets out the best treatment protocols for people with asthma in Australia. So that's probably the number one take-home message. And number two would be to look at a step back a little bit and looking at a population level situation and looking at asking the community to look for opportunities to work with each other and work with the asthma foundations across the country to tackle this challenging issue, for example, of effective self-management, which is a function of preventer medication adherence, so that we can start to understand a little bit better the narrative around people's experience looking after their asthma and develop more adapted strategies together in a multi-pronged approach, using the best experiences and knowledge and skills of organisations like the Asthma Foundations and healthcare providers in the community and at more kind of organisational level, so that we speak a little bit more coherently to people with asthma, and they actually take on and are empowered to be better self-managers.
And Anthony, my favourite question in every interview is about misconceptions, because generally there are misconceptions in every workplace and industry and endeavour. Is there a misconception amongst your clients, patients, clinicians that keeps you awake at night?
It's a good question. Thanks, Wayne. The greatest misconception that keeps us all awake at night is that asthma is a problem that's been solved, like I referred to earlier. And it clearly isn't. The economic statistics tell us that it's not. The individual patient contact experiences and conversations that we have over the phone to the tune of 2,000, 2,500 a year tell us that it's not. People with asthma who suffer symptoms, who experience complications, can't breathe properly. And if that's not a strong enough motivator for us to put all of those high-level statistics together and to make sense of what it means also to the people, then I don't know what is. And I think that it should galvanise us all to see what we can do to work with each other and the foundation to improve those situations, those outcomes for people with asthma.
Thank you for that, Anthony. For people who want to know more, I wonder if you could give us the website and maybe the 1800 number as well.
Sure. So the website address is www.asthmaaustralia.org.au, and when you go to the website, you can select your location from a menu in the top of the home page, and that will give you some local information, but it will give you access to quality controlled resources irrespective of where you're joining from. And our 1-800 number, if you want to talk to somebody about asthma, if you know somebody who needs help with their asthma, it's 1-800 asthma, which is 1-800-278-462.
Thank you very much for that. And Anthony, thank you very much for joining us today on Health Professional Radio.
It's a pleasure, Wayne. Thanks for inviting me.
If you just missed my conversation with Anthony Flynn, the General Manager Programs and Information Services of Asthma Foundation Queensland and New South Wales, then the good news is we have a transcript on our website, and we also have an audio archive of the interview both on YouTube and SoundCloud, so you can catch up with all of those resources at our website at www.hpr.fm. Thank you for listening to Health Professional Radio. My name is Wayne Bucklar.